Hi there, Danna here with Lean Healthy Ageless and the co-author of the Eat, Live, Thrive diet. And I'm excited today to bring back my personal naturopathic physician and a wonderful, incredibly knowledgeable man that has written so many books, I can't even number them, Dr. Mark Stengler. Hi, Mark.
Hi, Danna.
How many books have you written? Do you even remember?
I think depending on the editions, it's around 30, I've been told.
Oh my goodness. Well, I have some of your key books on my bookshelf all the time because I refer to them. I can look up all sorts of interesting things, whether it's a malady or a supplement, or if I'm looking for an alternative to prescriptions and all that. You have well equipped me for years. So today I thought it'd be great if we could talk to our mostly female audience of 50-year-old plus women about hypothyroidism, about the thyroid. I mean, we've all heard of it. So many women are being treated for hypothyroid, but there's also a lot of women, it seems like, that have symptoms of it, but their blood work comes out in what, is called normal range. So let's just open up that discussion. And what do most women need to know that maybe, they're not hearing through their mainstream doctors?
Well, I think the main thing for women to understand is, first of all, a lot of women are affected by hypothyroidism or low thyroidism. It's very, very common. And I think, as in terms of what you're saying, here tends to be the issue. A lot of women, when they're screened for low thyroid, which, by the way, can be symptoms like fatigue, slow metabolism, inability to lose weight, intolerance to different temperatures, especially chilliness, loss of hair, loss of the eyebrows, dry skin, constipation, depression, anxiety, and many, many other symptoms. So the reason for that is, God's designed us so that every cell in the body is affected by thyroid.
Oh, really?
It's very interesting when you look at it, the complexity, but to keep it simple, when our thyroid gland below our Adam's apple produces thyroid hormone, these thyroid hormones go into all the cells of the body, and it tells the DNA how to be active in terms of metabolism, burning oxygen for energy. Mm-hmm. And that includes making heat, which means metabolism, which means, brain function, heart function. I mean, it affects everything, really. So that's why there's so many symptoms you can get. But I think the problem is a lot of doctors do screen people for thyroid, but they do very, very basic tests, number one. A lot of doctors just run like what's called a TSH, thyroid stimulating hormone. And that's a hormone released by your pituitary gland in your brain. And it actually receives messages from another part of our brain called the hypothalamus. And so, interestingly, as blood's flowing through our hypothalamus, area of our brain, it has receptors in there. And it senses if we got enough thyroid. And if it's sensing we don't have enough, it tells the pituitary gland, hey, put out more of this TSH to tell your thyroid to make more thyroid hormones, like a messenger system. Mm-hmm. And the opposite, if you're getting too much, then it sends out less of a message. So, but here's the issue. So it's just it's an indirect marker of thyroid function because our thyroid gland produces these two main thyroid hormones, T3 and T4. Mm-hmm. It actually also produces T1 and T2. There's not as much known about them, but they do have function. And so, depending on what's going on with the person, high stress levels, which, as most people nowadays, high stress levels, poor nutrition, genetics, environmental toxins, head injuries, things like that, that messaging from the pituitary may not be accurate. And so if you're just relying on it, you're missing, issues. Mm-hmm. So that's one issue. Number two, we have to remember when we're doing blood work and measuring your thyroid hormones, let's say your doctor does more. He does your free T4, which is your active T4 hormone. He does your free T3, which is good. Let's say he does that. Well, we have to keep in mind that's just what's circulating in your blood. And as I mentioned before, these thyroid hormones eventually end up, or are supposed to be, going into our cells and then having their effect on our DNA and our metabolism. So we are not measuring what's going on inside the cell where the activity is taking place. And so people can have what is called thyroid resistance. I know you've educated listeners on insulin resistance, right? Produce hormone insulin, the cell's not receiving it properly, and so it's not having its proper effect. Well, the same thing can happen with your thyroid hormones.
Wow.
And so you may have symptoms of low thyroid, but your blood work looks relatively normal, but we're not testing what's going on inside your cell. And that's why it's so important for doctors, and this is what holistic or integrative doctors like myself do. That's why it's so important. Yes, do the lab test, but also put a lot of credence on the patient's symptoms. Don't discount their symptoms and just look at the lab tests, which conventional medicine in the last 40 years, I mean, that's really a lot of the training's been, look at the lab tests, kind of ignore what the patient's telling you. And that's one of the main problems we see.
Well, I also wonder, when we look at lab normals, those are extrapolated from so many people. Don't some people, normal for them may not be what falls into the normal range on a standard blood exam. Not only are you not getting what's really happening in the cell, but what's normal for them.
Yeah.
So I know we've talked about this before where you've said very cautiously sometimes if those symptoms present, you will start very gingerly putting people on small doses of thyroid replacement to see if it changes the symptoms. Is that correct?
Yeah, and yes, it can be, and you raise a good point. I mean, that comes back to lab values, reference ranges, not just thyroid, but all sorts of different things we test. It is one of the weaknesses in medicine because most labs do not differentiate between a general reference range, an optimal range, and a suboptimal range. So, for example, there's been some very good studies published just on the TSH, which we talked about. It's like you said, depends how you look at these reference ranges. Let's take T3, the most active thyroid hormone in the body, the free T3. Most labs have a reference range of about 230 to 420 units. Okay, so let's say you're a patient, let's say you're 250, and you have the symptoms of low thyroid. Most doctors would look at it and say, you're in the normal range, there's not a problem. We'd look at it and say, hey, you got symptoms of low thyroid, you're on the very low end of the normal range. We shoot for at least a mid-range to three-quarter range. Let's do some things either naturally or with natural thyroid hormone, get it up and see if your symptoms, resolve.
Excellent. Okay, I have another question, Mark. You've treated me for years for Hashimoto's. I was diagnosed when I was about 44. I've been on the bioidentical Armour thyroid. I've never had any negativity. I mean, every year you test my levels, we adjust them up or down based on my function. Now, you did tell me once when I went off it I can remember what reason, that it can actually create some cardiac health issues when your cholesterol can go up and so forth. But my point is, I feel great. I've been able to maintain a healthy weight, but I hear a lot of women fearful of being on thyroid replacement therapy. Are there dangers and risks to being on thyroid replacement?
I mean, yeah, I know what you're talking about. There's been some misinformation out there kind of against the anti-holistic, anti-integrative doctors, and that, these bioidentical thyroids, I mean, they can be dangerous and this, that, and the other thing, which is really absurd because what it comes down to is it doesn't matter what thyroid you give a patient. You give them synthetic thyroid, like say Synthroid, one of the most commonly prescribed drugs in America, or if you give a bioidentical thyroid like the one you're on, it really is irrelevant. What's relevant is how the patient feels and if the lab values are showing you're not getting excessive amounts or not getting enough. So it's really kind of a crazy thing that some people say that can be dangerous because you can make the argument for any kind of thyroid. If I overdose a patient long term with any type of thyroid, synthetic or natural, yeah, you can stress the heart out and cause anxiety and insomnia, but responsible doctors, like the ones in our clinic, I mean, we're not going to have a patient go years without testing them. We're normally testing every 6 months. So it's just not going to happen. We're going to find out if that's an issue. Now, I occasionally see some new patients come to clinic and for whatever reason, their doctor hasn't tested them in 3 or 4 years. I mean, crazy things like that. So no, I mean, it can't happen if you're doing it properly.
So if you're on the proper dose, there really are no concerning long-term side effects for being on the thyroid replacement. I just wanted to have you clarify that because
not at all. I mean, it would be the opposite. I mean, your health is going to be so much better because every cell is affected. But yeah, if you overdose a patient with thyroid of any kind, yeah, you could cause side effects. But that's true of any medication.
Exactly. Is there much of a benefit in going bioidentical with the Armour thyroid versus the synthetic? What is the advantage? Because it's usually outside of insurance because you're using compounding pharmacy. I've always gone the more natural route, but I'm spending $50 a month out of pocket. What's the...
Yeah, well, when we talk about bioidentical thyroid, there's different types. I mean, there's the Armour thyroid like you're talking about. And depending on the person's insurance, I mean, you can get that from a regular pharmacy often, get your insurance covered, but it's relatively, pretty inexpensive. Then you can have the more intricate where you can get compounded whatever dose you want for the patient, by the microgram. The more complex cases, we might do that. But yes, there are studies that actually have examined this. Actually, on my website, americasnaturaldoctor.com, I reviewed a study that came out in the past year where they examined seniors on synthetic thyroid. And then when they were switched to the bioidentical, they felt much better energy, better metabolism, better mood. So there are some studies out there that have done this. There was another study done about 5 years ago where they looked at the same issue. And they found that people that were on bioidentical thyroid did much better in many different categories, including when they converted over, on average, they had about a 5-pound weight loss.
Okay. Well, I'm staying on my bioidentical. I just wanted to get reaffirmed why I was doing it, and so you can sometimes get Armour Thyroid if it's in the proper doses at a regular pharmacy.
Oh, you can. You absolutely can. And here's one thing to remember, Dan. And here's maybe one of the biggest things with the bioidentical thyroid to remember. In the human body, the most active thyroid hormone by far is the T3. So when people are taking the standard thyroid medications, the levothyroxine, the Synthroid, the Levoxil, the synthetic T4 medications, they do not contain the active T3. The doctor is hoping that you convert it into the more active T3, but like I mentioned before, based on genetics, your nutritional status, your stress level, your liver and kidney function, and some other factors, you may not be converting it into the more active T3 effectively. And most doctors don't look at your active T3 in the blood work, so they don't know. And so as a result, you're not getting the full benefits of the thyroid, because in the end, it's really what your free T3 level is. It's not really so much what the other levels are showing.
Okay, that makes sense.
You're guaranteed to get that active T3 when you take the bioidentical.
Well, let's close with one more question. How many women probably as they age, let's say 50 plus, are going to face off or have some level of diminished thyroid function? And number two part of the question, should every woman be tested every year? Does it change that frequently or potentially to get that T3, T4 level?
Good question. Well, in terms of between having diseased thyroid and suboptimal thyroid, where could it be improved? I'd say we find it's probably about 50% of women.
Oh, wow.
In totality. So most women can be improved to some degree or another. Now, again, it doesn't mean it has to be thyroid hormone.
Right.
For example, just improving the diet, like the things you guys do, making sure the patient has enough selenium, iodine, iron, all those things you need to make thyroid hormone. I mean, sometimes you just got to correct some nutritional deficiencies, improve the insulin resistance, which you guys work with a lot. So you bring the insulin levels down, actually it takes away a suppressive effect on the thyroid. And then balancing out the stress hormones. One of the biggest things that suppresses thyroid in women and men is high levels of cortisol. And you guys do a lot of work on the mental, emotional, spiritual realm. And so by doing that and reducing the cortisol, you're going to, free up the thyroid activity.
Excellent. Excellent. Well, Mark, thank you again for just keeping our women well informed and being able to encourage us that there's so many things we can do. You reemphasize it again and again, and that is our lifestyle matters.
Right, absolutely.
What we eat and the kind of nutrients we take in on a regular basis and keeping our stress down and addressing body, soul, and spirit. So God bless you for all the work you do. I'm so blessed to have you as my personal physician, and we'll look forward to having you back, I hope.
Thank you.